Welcome to Forum 360 on Fusion, your PBS channel and your Rubber City radio stations. I'm Stephanie York, your host today, and thank you for joining us for a global outlook with a local view. If you live in Northeast Ohio, you've heard of Akron Children's Hospital. With more than 1 million patient visits a year, Akron Children's has led the way to healthier futures for children through quality patient care, education, advocacy, community service, and medical discovery since 1890. And today, I have the honor of talking with Bill Considine, CEO Emeritus of Akron Children's Hospital, author of several books, and a fierce advocate for children, our children. A man who has put over 40 years of his life into creating the Akron Children's Hospital that we've all come to love. Around 1.5 years ago, Bill stepped back from the CEO position, but he did not step back from children's advocacy and philanthropy work. And we are going to catch up with him today and find out what he's been doing with his time on behalf of our kids in Northeast Ohio. Welcome, Bill.
Well, it's great to be with you, Stephanie. Anytime I can have a chat with somebody that is so committed to our community like you, that's a pretty special day.
Wow, it's special for me too, let me tell you. So as we get started, can you tell us a little bit about yourself and how you ended up as the leader and face of Akron Children's Hospital?
Well, you know, I'm a native Akronite. I was born and raised here in this beautiful town. I went to Archbishop Hoban High School, went to University of Akron. During my time there, I was actually president of student government. And one of the talks I gave in town, there was a man in the audience by the name of Roger Sherman. He was the guy that ran Akron Children's, and he introduced me to the idea of healthcare administration. So I went on to Ohio State. I got a master's degree in hospital administration. It was during the Vietnam era. I served my country as a lieutenant in the public health service. After my 2-year commitment, I got married to Becky, who's been the joy of my life for 47 years. We took our first job in Chapel Hill, North Carolina. We were down there from 1972 to 79. And just by chance, a search firm called me one day from Chicago and said there was a job available in the Midwest. And it happened to be at Akron Children's. I threw my hat in the ring, came and interviewed, and they fell in love with Becky and hired me back in 1979. So it's been a phenomenal run. Being able to come back to your hometown and join an organization that has the credibility of Akron Children's was just something that was magical, quite honestly. And the mission of that organization, the history of that organization, the promises that are so much part of its day-to-day work are part of my spirit, part of my being, and will always be. So that's a quick history. And, you know.
Well, that is a really good history, and I want to.
Go ahead.
I want to thank you for your service, first of all. We very much appreciate that. And of course, we do really love Becky. And I do believe that everybody fell in love with Becky. No offense, Bill, when you came for the job search. Reflecting on your time at Akron Children's, is there 1, 2, or 3 projects that really stand out as critical accomplishments, things that you are most proud of?
Well, you know, there's so many stories I could share with your audience, and they're all very impactful. And, you know, they start with the whole concept of service above self. And when you open your heart to the people that are coming into an organization like Children's, your spirit can really be enriched. And again, I learned to appreciate how the community embraces the mission of Akron Children's. You know, going back to the epidemic back in the 1918s, the way the community worked with Akron Children's to deal with the Spanish flu, to talk about the polio epidemics, both of which occurred during my lifetime as a child, and the way that Akron Children's and the community worked together in terms of reaching out to the families. So when I came into the position, there was wonderful foundations to build on. And I think about the way that the community got together for the Ronald McDonald House. We did not have a Ronald McDonald House when I started at Children's. Families were sleeping in the hallways. And when we threw that idea out on the table, people like Jerry O'Neill and Bob Mercer and the major corporations, and then most importantly, the parents that were wanting to be part of, something that was going to be a solution to that, they came together, and our house was just, and still is, spectacular. I think of the work we've done relative to investing in outpatient primary care and our network of primary care offices that now number probably 30 and see over 500,000 children each and every year, and taking healthcare closer to home. I think of the investment we made 10 years ago in Youngstown when Todd Children's Hospital was getting really put on the sideboard and going to be closed because of some of the issues its parent organization was facing. And in the 10 years we've been in Youngstown, we now have as many employees in Youngstown as we had in Akron when I was hired in 1979. And I look at all the children that are being cared for there. I mean, it is enormous. And then I just look at, the investments that we've made relative to patient care. And our workforce has grown from around 900 now to over 7,000. And what's beautiful about all of that is the focus on the three promises that the women that started Children's Hospital back in 1890 put on the wall behind the reception desk. And when you walked into that Mary Day nursery at the time, you saw those promises. And one of them was right out of the box, every child that comes through these doors, we promise to treat as if that child's our own. The second promise is we promise to treat you the way you want to be treated. And the third promise was we promise never to turn a child away for any reason. And when I think about my 40 years, we lived up to those promises and still live up to those promises. And during my time, we never had to lay anybody off. We continued to invest and invest and invest in more services for the children we're privileged to serve. So it made me a better person, Stephanie, I tell you. And I want to continue to give back to that phenomenal organization.
Well, and you've made Akron a better place with all the expansion and growth. And I got to tell you, I have 3 kids. We've utilized Akron Children's many, many times. I think I have a frequent flyer card. It's been invaluable to us. The 3 promises that are in the waiting room or when you come in, you really do live up to that. And it is just incredible to have that in Akron, Ohio, in Northeast Ohio. The last year and a half, you've been really focused on advocacy and community initiatives. Let's first talk about advocacy. You started a white paper on advocacy. Can you tell us about that?
Sure. During my time as CEO, there's a lot of hats you wear. And, one of the hats that I did wear and was proud to wear it was being a voice for children. And, visiting with elected officials at the local, state, and federal level. I was chair of the National Association of Children's Hospitals during my tenure. I chaired the Children's Miracle Network. I chaired the Child Health Corporation of America. And in those national forums, was able to talk with elected leaders about what we needed to do for our children. And when we were doing this transition and passing the baton to Grace, who's a wonderful CEO and president of Akron Children's, the feeling was it'd be nice if I could continue to use my voice and advocate for children. One way we thought we could do that is creating something that we named the Considine Report. And it was launched in 2019. The first edition of that report laid out a series of about 6 or 7 objectives we wanted to achieve during the period of time that we were going to be focused on that report. And then we have every quarter another edition of that report. We talked about last year the importance of asking men and women that are running for office, ask them specific questions about what their agenda is going to be for children. And we gave some hints in terms of what you could address and ask those folks that. We had another edition that talked about the importance of investing in children. There was a Fram air filter commercial at one time that said, "Pay me now or pay me later." And we were able to show that when you don't invest early on children, you're going to pay much larger cost later on for kids. We had another edition that talked about creating an awareness of how important Medicaid is to children. A lot of our people in this country do not know that Medicaid is the #1 insurer of pediatric health care in the United States for children. And it's always being attacked and it's underfunded. And we laid out some really specific numbers about that. And then we also had an edition last year that discussed the importance of us as adults to model the way. And, you know, kids learn from our actions. They hear our words. They see how we behave. And we need to do a better job in terms of being civil with one another, being respectful. And we talked about that in one of our reports. And then we also pointed out when it was budget time, how the children's line items in the budget continue to be decreased to the point where now in the federal budget, only 7% of those dollars are going to children's programs. And that's the lowest it's been in our history. And we talked about why, you know, that's going to cost us bigger dollars, more importantly, cost us children's lives if we don't turn that around. As we kicked off 2020, our white paper was focused on why don't we make 2020 the decade of the child and try to have a focus every year in terms of some social determinants that are impacting children in a negative way. Let's talk about housing. Let's talk about mental health. Let's talk about poverty. Let's talk about all sorts of other initiatives and dealing with the obesity and the suicide rates and things that are going up. And then the first edition of a Considine report in 2020 focused on the census, because we looked at the census in 2010 and we undercounted children in 2010 by over 2 million. And when you look at what that costs in terms of dollars over a 10-year period of time, we're talking about 5 to 10 billions of dollars that never came to children's programs and should have come if we would have counted kids accurately. So we're worried that this time around in 2020, we're going to also undercount kids. I know here in Ohio, in talking to the governor and others who are very supportive of us having an accurate count for kids, they've pointed out to me that because we undercounted kids in Ohio 10 years ago, that cost us somewhere in the neighborhood of $26 to $30 million a year of funding that could have gone to children's programs. So I'm trying to make this more than words in terms of what we put in writing, but get an understanding and awareness of our public so we can start treating kids the way they should be treated. Let's invest in them. They are our future. So let's believe that. I mean, 17% of our budget is military, and military is important, but 7% only going to kids, we're missing the boat.
We are missing the boat in that. I mean, kids are our future. And if we don't realize that and put money into them, I fear for what's to come. So we see how the census is so important and how we're going to focus on that and get that going in Akron, in Northeast Ohio, and really in Ohio in general. What can we do? What's your call to action for people to help you with that mission?
You know, fortunately, there's been no pushback when we talk to our various organizations about the importance of the census. I mean, it's also important relative to how many congressional seats we have in the state of Ohio. And, you know, talking to the Attorney General, talking to, like I said, the governor's office, talking to Frank LaRose, who's a friend. Everybody is trying to do what they can to get the message out. There's a number of grassroots community action entities that are working on this. Now, unfortunately, with the COVID-19 pandemic and how that's hit us, and you know, the technology being what it is, with a lot of the census documents being done electronically, we're behind where we need to be. And I don't know if they're going to extend the period of time for when people can file their census, but we need to, again, be good voices and advocates and ask the question of groups we're in, is there anything we can do to help you in terms of getting census information in front of the people that haven't filled it out yet. I also worry that, some of the activity that's taken place on the national level relative to our immigrants that are in this country, our refugees that are in this country, that, we are going to undercount that population of kids that have been born in this country and are American citizens. So, let's not have the same mistake occur in 2020 that happened in 2010. Now, again, as I said, Stephanie, no one argues with that. The thing is, we need to, as you said, marshal our voices, our energy, and the various groups that can really do something about making it easy for people to fill out that census document. And a lot of people are worried that it's going to be used against them. And that's just unfortunate. It's wrong.
I agree. And I think I'm going to make this call to action. If any of our viewers are out there and they want to jump in and help get the word out about the census and help make this easier for people, contact me. My email is york@crisiscommunications.com. Contact me and I will make sure you get in touch with the right people so you can be an advocate for the census. It's really important, as Bill mentioned. I'd like to remind our viewers and those who may have joined late that we are here with Mr. Bill Considine, CEO Emeritus of Akron Children's Hospital, author of a couple books, and fierce advocate for children. We are discussing advocacy initiatives. COVID-19 challenges are coming up, and we are now moving on to community initiatives that he and his wife, Becky, are heavily involved in. Can I ask you, we briefly touched on how the COVID-19 pandemic has impacted the census. Has it changed the focus of your initiatives, your community initiatives at all this year?
Well, actually it has. If anything, I've even picked up the pace relative to work I do with United Way, work I do with our schools, work I do with just countless organizations, and trying to be a voice, be ears that can listen to what they're trying to do relative to the challenges that we're all facing. Relative to even my advocacy role, COVID-19's pointed out to me too that we've been remiss in not investing in public health. And I'm working on a paper right now that talks about how public health is so important to our economic vitality. And we're seeing that every day because of what COVID's done to our healthcare in this country. It's had an effect on our economics. And when you look at how we have reduced funding for public health since the recession years, again, it parallels the same thing I just mentioned relative to children. And I've had some conversation with Dr. Bill Keck, who's a phenomenal public health man. I'm on the advisory board of the Ohio State University's College of Public Health, and have talked with their dean, Dr. Fairchild. She's really a phenomenal individual. And then we're seeing on a day-to-day basis here how important a person like Dr. Amy Acton is to everything we do, and our governors recognize that. So it has changed my focus. It's changed even my advocacy role relative to we need to be doing a lot more in terms of promotion of public health and be proactive, not reactive. There's a lot of examples of how we've been reactive in trying to address, smoking, trying to address the need to have fire alarms in your homes and things of that nature. Well, let's get ahead of the beast out there. And I'm spending time on that, Stephanie. I just can't help myself.
I know you can't. So as part of the pandemic, the CARES Act has come out. Has that impacted children's issues? And how's the CARES Act, how's that relevant right now?
Well, the CARES Act is relevant for healthcare providers. Early on, in order to try to be prepared for a wave of, pandemic patients, hospitals stopped doing elective surgery. Even children's hospitals, we emptied out beds. We freed up some beds that adult hospitals could move non-COVID patients into, so they would have more beds for the COVID patient within their adult hospitals here in town. And consequently, there was a lot of revenue that didn't really come into our local hospitals. At the same time, there was an additional expense they had to deal with. The CARES Act early on said they were going to try to help the hospitals. It's interesting, in the first version that happened, children's hospitals were excluded because they weren't identifying adult, it was all based on Medicare adult patients. Children's hospitals don't have a lot of Medicare, if any, so they got closed out. So in conversation with our senators, Senator Portman, Senator Brown, also in my conversations with Tim Ryan, Congressman Gonzalez, Congressman Joyce, you started pointing out how children's are affected too. And in the second wave of that, they did put $700 million that then got distributed out to children's hospitals in this country. And Akron Children's in the first pass got around 16.6 million. That helps offset some of the expenses and lack of revenue. It didn't solve all of that issue, but it does help. And again, I think it's important for your listeners and your viewers to, when they're talking to their elected officials, don't be afraid to bring this up. I mean, there's been a lot of stops and starts within the CARES Act. My heart goes out for the people that have been furloughed. I have a son-in-law that's been furloughed. I have friends that have lost their job. I have friends, businesses that have been really affected. And the CARES Act was hopefully going to address some of that, but it can't address all of it. And I think, again, even with what's going on with the tragedy in Minnesota now, that we need to rise as a society, all of us, and recognize our failings and quit making excuses about our failings and start to come up with solutions.
We do. There's a lot going on. 2020 has been anything but typical,
Right.
to say the least. But I got to tell you, your advocacy and on these children's issues is what got the CARES Act to include hospitals. I mean, you and others, but without that advocacy, it never would have been funded. So advocacy works. People need to get involved. Like you said, they need to speak to their elected officials and tell them what's important to them. And by golly, if our children aren't important, I don't know what is.
Right.
So I want to shift gears a little bit. Tell me
Sure.
about the books you've written. I'm so fascinated by the Bill Considine, the author. We only have a few minutes left, but I want to hear a little bit about the books you've written.
Okay, well, I've done two. I did one called Leadership. It was based on a talk I've given for years, where I just take the word leadership and I apply 2 words to every letter. So the L in leadership, what works for me is listen and learn. And E is, there's 2 E's in leadership, and I talk about the importance of energy. I talk about the importance of empowering others. You got to earn it, and you have to excite people with a dream and all. So every letter has 2 words, and I put that in writing. And then I also brought into that book life lessons I learned from children that I've interacted with over my 40 years at Children's Hospital. So there's a children's story in every one, and there's a wonderful story about a patient by the name of Angie and sun catchers. And I don't want to steal it, but that I talk about my sun catcher story all the time. The second book kind of grew out of that because a lot of people like the leadership, and it's on success. And I play on the 2 C's in the word success. And every chapter in that book starts with the letter C. There's a chapter on civility. There's a chapter on communication, cooperation, collaboration, culture. And in every one of those chapters, I talk about somebody that epitomizes that. When I talk about character, I talk about Phil Maynard. When I talk about some of the collaboration in town, I talk about what's come out of Heart to Heart and how they've brought people together. Dr. Fowler and, just a number of people, Father Norm. It's, again, they're not bestsellers, I don't think, but I tried to capture things that have worked for me, to tie one of your comments together too. And in advocacy, it's more than just, telling people what needs to be done. You got to give them solutions. Don't just complain you don't give me enough money. Show how you can spend the dollars you do get more efficiently, and why additional investment even makes more efficiency. And both those messages are captured in both those books.
Today, I've had the honor of talking with Bill Considine, CEO Emeritus of Akron Children's, author and fierce advocate for children, a man who's put over 40 years of his life into creating the Akron Children's Hospital that we love. And although he may have stepped back from day-to-day operations at the hospital, he and his wife Becky have not stepped back from fiercely advocating for children and philanthropy work in Northeast Ohio. Thank you, Bill, for all you do for Akron's children. Akron's children, sorry. I'm Stephanie York. Thank you for joining us on Forum 360 for our global outlook with a local view.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.